But I think the real innovation for us was the health insurance side.
That's right. So if you think about this, 14% of the people that come to Fountain Life, we do full body MRIs, we do everything. And many of you know now there's like the Grail test that can find up to 50 different cancers. You know, the challenge with cancer is most of the cancers that kill us because we find them at stage 3 and stage 4. And usually that's because we don't have a test for it. Most of the cancers we don't have.
70% of all cancers that kill you are not being tested for.
That's correct. And so the study shows that if you get it at stage 3 or stage 4 diagnosis, you have an 80% chance of dying. I prefer the 20% chance of living, but their point is if you get it at level first stage or second, you have between 90 and 99.9% chance of survival. So we have people come in, 14% of the people that come through our centers have a life-threatening issue they don't know about that we can handle immediately. And I had one friend that went, his wife kept pushing him, and I said, you know, you might want to listen to your wife. He's got good ideas here. He said, oh, I've been to the doctor. And think about what a physical is today. It's the same crap that you went through 50 years ago. It's absurd. You don't really learn anything. And yet we have all this incredible data that we can pull out, you know? So people come in and they discover he came in and found out that he had kidney cancer, stage 1, an outpatient procedure, took him 45 minutes and he's totally fine. I can't tell you how many people come to me and said it saved my life. So 40% of the people that come see there's multiple things they can do to massively increase their energy. It's either a hormonal issue or some other balance as well. So people come in and they discover things, but we were talking about how do we make this, you know, financially able for people. And so we formed, you know, a life insurance company, or I should say health insurance company rather, where it costs the same amount of money as any other health insurance. But what we do is we do all this testing up front. We invest in the money up front. Most of the expenses on the back end where people are dying. So we not only save lives, the most important thing, but we make it economically feasible for people to be able to have all their employees know where they stand right now. Catch it when it's little. Now, I was one of the people who used to like, I don't want to know this stuff. I don't want to hear all this. You might find something that's really not there, but I was totally wrong. When you dig in with the data we have today, the false positives are so small, you're crazy.
You're going to find out eventually. When do you want to know?
That's true.
Yeah. And, you know, it's a transformation, and it drives me nuts. The healthcare system we have in the United States, at least, is so expensive, and its performance is so poor. Yeah. And we need a revolution. And
it's disease care. It's not health care.
It's disease care. And so there is nothing more valuable than your health.
Yeah.
So I'm very proud of the team and what we've done there. And if it works successfully, we're in a situation at the end of the day that will transform and flip the insurance company, right? Fire insurance pays you after your house burns down.